can apply for same. So Canada, a province in Canada, has a work stream for healthcare workers. I don't know how much you guys know about that. I think it has been established around 4 years ago. I don't know if many of our colleagues within the Caribbean, other countries in Europe, Africa, all over, they are aware of this. So that's what I'm going to be talking about tonight. Welcome to everyone who is here on TikTok and those that are live on YouTube. So you guys can come over to YouTube if you guys are interested. So we're going to talk about the Canadian healthcare worker stream. This is for all healthcare workers. They have a stream for same. How are you guys doing? We have so much that I can talk about, but this has been published in my newsletter. I did publish this in my newsletter and said I'll be talking about this. Hopefully next week we can talk about some other stuff. Welcome to everyone. Let me give some persons some time to come in. And if you're in the chat, let me know where you're tuning in from. Welcome, everybody. Welcome to Marshallee, Home Care Nursing. I'll be talking about the Canadian healthcare worker stream. There's a stream in Canada in a province for healthcare workers. I'll be going through that and discussing how you guys can sign up for same. All right, so Marshallee says she's from Jamaica. Where are you guys from? Who else is here? Let me know which country you're tuning in from. We'll be talking about as work stream for healthcare workers who are interested to migrate to Canada. That's what I'll be talking about tonight. Also, guys, on YouTube, I have my visuals on YouTube. I'm going to show you the step-by-step process. So Manda Smith says she's from Jamaica. Share up the live, share this with some other person. So if you're a healthcare worker right now, and you want opportunities, there's a province in Canada where you can sign up for their healthcare worker stream. So you guys can hop over to YouTube if you want. Empowered RN on YouTube, where I'll be sharing the video and outline the step-by-step process so you can do same. It's not only RNs, I said healthcare workers. I'm going to give you the list of all the qualified persons, not only healthcare workers. All right, so I'm going to start right now. I'm going to show a YouTube video. That's why I said if you're over here, best if you come on YouTube, I'm going to show you a video talking about the province is Saskatchewan. I hope I'm pronouncing it right. So they have a healthcare stream for healthcare workers. They have been having, I think when I talk to some persons that are there, they always talk about Saskatchewan, who is in dire need of healthcare workers, especially nurses. So they have a program for same. So I'm going to be playing this video now on YouTube, where individuals can see a news briefing that was posted by, I think it was the CBC, and they talked about workers are at a breaking point, Saskatchewan healthcare workers, and they gave a response to same.
And low wages. These are among the poor retention and low wages. Poor retention and low wages. These are among the many factors 3 unions representing nearly 30,000 Saskatchewan healthcare workers are saying is leading the industry to a crisis.
We're seeing workers leaving healthcare. It's too stressful. They're not being compensated properly.
In a letter penned Tuesday, the unions are asking the Premier to act on promises made during last year's election to fix the healthcare system, saying, quote, workers are at a breaking point.
They have heard loud and clear from the people of Saskatchewan that healthcare is a challenge, and they committed to do their best to address the issue. And we have been patiently waiting for that.
But the unions aren't the only ones speaking out. On Tuesday, a letter signed by more than 400 health professionals released to the public, raising concerns about overcrowding and short staffing at emergency departments while offering potential solutions.
Health Minister Jeremy Cockrell responded to the letter in a statement Wednesday, acknowledging the challenges and listing commitments to increase hospital capacity capacity in Saskatoon and Regina. Capacity isn't the issue.
We are not interested in new facilities because we don't have the people to staff those facilities. We want the commitment to the workers that are in the system.
In response to the letter, the NDP say they will be demanding accountability from the province during the first question period Thursday.
So I'm asking for Minister Cockrell to come here, to listen, to show he cares, and to make a plan. And that plan needs to address both retention and recruitment.
At the legislature on Wednesday, Minister Cockrell says he is focused on competitive wages and recruitment of healthcare workers.
What is going to help, I think, the most is making sure that the incredible doctors and nursing and other staff across our system have more people on their team.
Vanessa Tiberio, Global News.
All right, so that was a news briefing from CBC. Let me stop sharing here. And they were talking about the impact of Saskatchewan is having right now. So they're talking about the healthcare worker shortage, and you can hear what the union representative actually stated. They stated that they didn't want any more facilities because they said they just don't have the staff to facilitate same. So let's go do a breakdown into Saskatchewan, right? So Saskatchewan is actually one of the provinces in Canada. As you can see, I have a map here. If you're on YouTube, you can see it. You see British Columbia right there, Alberta. You see Saskatchewan there, and then Manitoba, and then Ontario. And with Canada, you have different provinces, just like how you have the United States, you have various states. So each state or each province in Canada has their own boards of nursing, similar to how the United States, I think, is set up. And you see a map right here also with regards to Saskatchewan there. Now, they have a severe healthcare worker shortage, as you can see in the video that we saw. Heard a while ago, you heard what they said. They want more staff. They need better. They didn't. The union representative even said that they didn't want any facilities because they don't have any staff for same, and they need proper recruitment. And I think that video was published last year, October 22, 2025. So that was just last year. So Saskatchewan actually has a program or a program for healthcare workers where you can directly apply to them. So with Canada, immigration is very different because you do immigration on your own. So you can apply for your permanent residency on your own. Unlike other countries like UK and the United States, you have recruitment agencies you will directly work with them and they will help you with the process. But Canada, very different. You basically do immigration on your own. However, this province, and if you're new here on TikTok, you can come over to YouTube. I have the visual set up talking about the healthcare worker program. I'm going to show you the website and how you guys can apply for it. Now, they have something that is called the International Healthcare Worker EOI pool. So this is also called the Saskatchewan Immigrant Nominee Programme. It's shortened to name SNIP. And they have two different categories for SIM. Let me know if you guys heard of this program before. Anybody heard of this program before? To those who are just joining, I'm also on YouTube. If you want to see, I have the visual over there. You can come over there. Let me know if you have any questions and let me know where you're tuning in from. I know a couple people were tuning in from Jamaica. So they said here, move to Saskatchewan with the International Healthcare Worker Expression of Interest. And that's what I called SNIP a while ago, right? So they said that if you're interested in pursuing a career in healthcare sector in Saskatchewan, they encourage you to create a expression of interest profile. And if your qualifications matches one of the healthcare occupations in demand, the employers in Saskatchewan's healthcare sector will reach out to you directly with information about job opportunities. When I saw this, I think this was pretty good because many times when you apply to the provinces in Canada, what they normally say is that you have to make sure that you have a job letter or a job offer before. But this program that they have in Saskatchewan is literally saying to you that if your qualifications match their healthcare occupations in demand, the employers, once you create that expression of interest profile, and you see right here, the yellow line right here, that's where you click on it. The employers in Saskatchewan will reach out to you directly with information. And if you're joining us, you can come over to YouTube to see everything that I'm talking about, all right? The same name as Empowered RN. So I'm live on TikTok and live on YouTube. Any questions, you let me know. So what is the International Healthcare Expression of Interest program that they're talking about? So they're saying that an international healthcare worker expression of interest submission is not an application to the program, right? It's a pre-application form which allows you to fill out an online form to indicate your interest in working in such occupation, and it shows your qualifications, right? So the information asked for is used to identify you for job opportunities being offered by Saskatchewan healthcare sectors or employers. They're now saying that if you have the skills needed, you will be contacted with job posting information, identifying where and how to apply for a job. If you are selected, you will then receive an offer letter, receive an employment offer, and you may be eligible for the Saskatchewan Immigrant Nominee Programme. And they have two pathways. They have the health talent pathway or the student category. So if you're already a healthcare worker, you would qualify for the health talent pathway. If you're a student, you'll qualify for the student category. However, they're saying that not all candidates who submit the EOI will receive a job opportunity notification. There are no limits, though, on the number of workers who can submit the EOI. However, candidates can only submit one profile. So you're supposed to have one profile. If you're just joining us tonight, I'm talking about an opportunity for healthcare workers. It's a stream for the province of Saskatchewan. I don't know if you guys know it already, but they actually have created this around 3-4 years ago, and they have a program if you're a healthcare worker where you can apply directly to them. Now, the healthcare worker program provides an opportunity to link foreign trained workers with Saskatchewan employers. So if you're a healthcare worker, they're going to link you to healthcare employers, right? However, foreign workers who receive an employment offer from a Saskatchewan employer do not need to create an EOI. So if you already applied to Saskatchewan and you have a job offer already, you would not need to create the EOI. However, if you're applying right now and you do not have a job offer, you would then need to create an expression of interest. This is on the government website, which is Saskatchewan Immigrant Nominee Programme. It's very easy to do, and you can do it on your own. Of note, guys, I'm not an immigration consultant. I'm not a recruiter or anything. Once I see opportunities or information, I'll share them to you here. I did publish this in my newsletter telling you guys that I'll be doing this week. We have a lot of things to talk about, but this is the one I'm going to talk about tonight. All right, so what are the occupations that are eligible? So they said international healthcare workers, right? So the international healthcare workers, the titles are, you can see right here. So if you're a health information management practitioner, you would qualify for this. If you're a public and environmental health and safety professional, occupational health and safety specialist, registered nurse, if you're a registered psychiatric nurse, you'd qualify for this. If you're a chiropractor, kinesiologists, and other professional occupations. If you're on TikTok and you want to see what I'm doing, you can come over to YouTube. The same name is on YouTube. If you're a nurse practitioner, you will qualify for this program. A physician assistant, a midwife, and you're an allied health profession, you would qualify for this. A pharmacist is also qualified, audiologist, speech therapist, physiotherapist, other technical occupations, and occupational therapists. Other persons who would qualify include, I think I left off something else. Hold up, guys. I think there's one more set of persons who would qualify for same. Let me just add that right here. So if you're new here, if you guys have any questions, you can let me know. So this is a healthcare worker stream for healthcare workers. I don't know how many of you guys know about this, that you can apply for same and start your process if you're interested to go to Canada. And that's a province in Canada called Saskatchewan. Now, the other individuals that would qualify, if you're a medical laboratory technologist, medical radiation technologist, if you are a cardiology technologist, pharmacy technician, other medical technicians or technologists, pharmacy tech, dental tech, Dental assistant and dental laboratory assistants would qualify for this. Licensed practical nurses, paramedics, other assisting occupations in support of health services. Nurse aides qualify for this. If you're an orderly and patient associate, you qualify for this, and psychologists and therapists. However, I'm going to stick up in licensed practical nurses. For you saw registered nurses. Let me start with the registered nurses. So if you see this and you're seeing the healthcare workers, you might say, okay, I'm an RN, I'd like to apply for this. This is for a province in Canada. Canada uses for their boards of nursing that of the NCLEX. So even though you're an RN and you're somewhere in the Caribbean, either Africa, you would qualify for this if you have taken your NCLEX, because remember, you're applying to their province. So, and they go by a point-based system. So if you put up your certifications and say that you have the NCLEX already, that's an added point for you. And that raises the probability of you being selected, right? Rather than you being submitting your qualification and just show for Jamaica that you have your BSN. To work in the province, you need an NCLEX, right? So make sure you have that if you're going to be applying for same. The next thing, licensed practical nurses. So the licensed practical nurses in the Jamaica is not going to be similar to those that are in Canada. The licensed practical nurses, they have a license and they do the board exams, and that's called the NCLEX-PN. So if you are a licensed practical nurse and you have taken the NCLEX-PN, this will increase your qualifications. Let me bring it back home to Jamaica now. For Jamaica, those that are known as licensed practical, let me term it a different way. So for Jamaica, the individuals who would be equivalent to a licensed practical nurse would be that of your enrolled assistant nurses. The enrolled assistant nurses have their license and their qualifications. If they match it and go through that of the CGFNS, will say that it is equivalent either to the US or Canada's licensed practical care nurses, right? So they are the ones who would qualify for this. However, if you are an EAN right now and you said, okay, I want to apply for this, before you can apply for this, what will improve or increase your probability of getting selected is making sure that you have taken the NCLEX-PN. So if you have taken the NCLEX-PN, which is the NCLEX practical nurses that the licensed practical nurses in the US and Canada take, this will improve your chances. And the reason why I'm stressing this, a lot of persons have we have a lot of mixed communication and knowledge going around back home with licensed practical nurses. Those that qualify for this are your enrolled assistant nurses. So I'm encouraging you guys, if you want international opportunities and there are specific countries that you want to go to, you need to look at what are the qualifications that will give you the opportunity to go to same. Canada and the US uses the NCLEX. Make sure that you have taken the NCLEX. You're a licensed practical nurse back in Jamaica, EAN. You want opportunities. Your best bet for you is to take the NCLEX-PN. And there are nurses who I've heard that have taken same and have been successful. So other people that can take this will be qualified. Your paramedics, other assisting occupations, nurse aides. I don't know what qualifications, probably if you did caregiver and you have your certifications, this would be a good opportunity for you guys. Psychologists and also therapists would qualify for same. Now with going to Canada, there's going to be an English language requirement in all things. Many countries such as the US, UK, some European countries, Germany, Ireland, Ilets will also be required. So if you're a registered nurse, you have requirements in terms of your IELTS and for the practical nurses. If you're going to be applying for a caregiver, any role that you see I have called out here, you have to have the IELTS. And there's a specific number that you will have to have. I think it's a 7. The overall pass rate, I think it's a 7. I was trying to get it up here, but if you go on the site, they will tell you how much you need to score in each area. So when you have these and you're applying to Canada, your NCLEX-PN or NCLEX-RN and the other things, so those who are not registered nurses, you will also need to make sure that you have the IELTS and your certifications. I don't know other certifications they will need for paramedics, but if you're interested to go same, just look at what the licensing body would require for those places and make sure you have done those exams and you're successful, right? So anybody that is on this list, all of you guys will need the IELTS Every single person, the nurses, paramedics, every single person is going to need an Ilets exam before you can take same. And also, if you're applying from outside, as I said before, for the nurse and the LPNs, make sure you take the NCLEX and make sure you have done your NCLEX-PN. Reason being, Canada uses a point-based system. And if you can show that you have taken the Ilets and you have passed, that's an added point. If you can show that you have taken the NCLEX-PN for the practical nurses and also that of the NCLEX for the RNs, I don't know what would be the requirement for the midwives though, but I know the Ilets would be recommended. So if you have those points, point-based system, that increases your capacity of being selected, all right? And this, the next thing I'm going to talk about is how to find an immigration representative or consultant. All of this that I talked about is listed on their site, and it's easy. You just click on the button to create an expression of interest. You fill out the form they say, and it's an application by invitation, right? So they're going to give you an invitation if you're successful. If you're successful, they said they're going to notify you, and it's based on their labor market and also their need, and they may have a target too. Right now, I showed a video earlier showing you that they have severe shortages. They hear the union rep said they don't need any more facilities because they don't have enough people. After you have submitted same, they will then send you an email to tell you if you're successful. But before you apply, they say that you need various documentation. The documentation is to make sure you have your education and your certification. I think you may also need to have probably an evaluation done to make sure that your licensing or your, say for instance, your education is comparable to that of the US, but they may, or the Canada or Jamaica, just to make sure it's comparable. Many of us use World Educational Services just to see if the degree that you hold in your home country is similar to theirs. They may require that. Make sure you have your Ilets, and also they say that you'll need to scan your documents and upload them in a PDF format. After that, they will then email you if you are approved. And if you are approved, this is what I want you guys to know. If you're approved for a nomination. And the nomination, after nomination, they say that no, you can apply to the government of Canada for immigration for your permanent residency. So this does not make, once you are approved, it doesn't mean that you're automatically going to start to go into Canada. They're going to nominate you now and allow you now to apply to the government of Canada for your permanent residency. Why I'm talking about this is somebody asked the question, what's the website to go on? I'll pin it in my comment section. Saskatchewan.ca/SNIP. I'm going to pin it. I'm going to type it in the chat. You can just type in Saskatchewan Immigrant Nominee Programme and it comes up. So you'll then get an application, submit an application, and you're nominated, and then they will send over your details for you to apply for permanent residency, right? So this is much easier instead of you going directly like through other provinces and just doing like, what do we call it? You have the express entry, doing all of that on your own, trying to find an employer. And before you can apply with the government of Canada, normally they'll say to you that you need to have a job offer, you need to have job letter. However, this province is allowing you now to just apply to their site, upload your qualification, and then job employers will reach out to you, give you a job offer, and then they nominate you and send you up to apply for permanent residency. So I believe that this pathway is much easier. I'll type it in my comment section, the places that you can apply, the details of where you can apply to. So this right here is much easier for anybody that is interested. Please note that if you're going to be doing this process to apply for permanent residency, you're going to be doing this process. You can use a immigration representative or a consultant. They have it listed on their site with different. If you wish to use an immigration representative, you can visit the site as listed below. If you want to use a consultant or a Canadian lawyer that is approved by the government of Saskatchewan, you can use this site below. And if you want a recruiter to assist you, it is listed below. However, they did list on their site that if you want to do this on your own, you can do it on your own. If you already have all the certifications, you have your Ilets already, you can just go on their site, upload it, and you wait for an approval or a response from them, and they can direct you. On their site also, they have a number you can call them. They also have an email where you can call, where you can send an email if you have any queries or any questions for them. So this route, I think, is an opportunity and it's very good. But before you guys can apply to this, make sure that you have the necessary requirements. The Ilets is the number one thing. Make sure you have that and you have a passing score of 7. And also, if you're a nurse or a LPN, make sure that you take the necessary board exams already and you can easily submit those on your site. And for other persons who are not a nurse or an RN, you can send a message to me if you want to know what, for paramedics, look at what the certifying exams will make you work internationally in these places and look if you meet those qualifications. Any questions? I'm going to pin the, let me see if I can pin the address, the website that you can go on. Once you type in Saskatchewan Immigrant Nominee Programme, you can see this on their site and everything is laid out. I think this is a wonderful opportunity. What am I talking about? This is a healthcare worker program for international individuals who want to work in Canada in a province called Saskatchewan. I've already went through it, talking about the process and all the different healthcare workers who are eligible to apply for SNIP. Sapphire, let me know which country you're tuning in from and what title are you. Is there an age limit? No, I did not see an age limit listed on their site. I did not see an age limit that was listed on their site. Any questions? Give me a second, guys. Let me put in my charger. Any questions? Did not see an age limit, but I think this is a good opportunity. A good opportunity for individuals who are looking for international work. Please remember, if you're going to be applying to anywhere, any country that you're going to, you actually need to have some amount of money, right? If you're going to be doing permanent residency for you and your family, remember you're going to need money. You have to show so you can take care of yourself for the first couple of months. So that is important too. If you're already crying that you don't have any money, I don't think you're ready to leave your country as yet. Is there any information about engineers? I did not see engineers, and this program is only for the healthcare workers. So there wouldn't be anything for engineers here. This is for healthcare workers. So nothing was listed there for engineers. So this is a stream by Saskatchewan for healthcare workers. So I don't think the engineers will be listed there. Any other questions? Pharmacy assistant or technician, yes, that is listed there. I have it on my screen here. It says pharmacy technician. So that will qualify for SNIP. So remember, guys, for this program, very good. I saw it and I said, this is very good program because what they're doing is setting you up for opportunity to get job. Employers will reach out to you once you upload your stuff to their system, and they'll give you a job letter, a job offer, and then nominate you to apply for your permanent residency. Good night. Is it only for RNs with experience and the NCLEX? I'm not sure, they didn't specify your experience in terms of RN, but if you're an RN looking to apply, the best thing for you is to make sure that you have the NCLEX. Reason why I said it's suppose you apply with just your Bachelor's of Science of Nursing. Even if you're nominated and you go to Canada, you cannot work in Canada unless you have the NCLEX. That's your Board of Nursing. And remember, it's a point-based system. So if you have the NCLEX and you have the Ilets, you have a lot of people going to be applying for this all across the world. And if you have all that they're looking for, that's a possibility of you being selected. Geriatric nursing. Geriatric nursing, I think, would fall under probably the nurse aides. They didn't specify in terms of geriatric nursing. There is licensed practical nurses, registered nurses, and that of psychiatric nursing. Any other questions? It would be caregiver. So the nurse aides would be caregiver. Yes. So Marshall said, Afflick said it would be caregiver. Yes. So that would be caregiver. So just make sure you have your certifications with same. And if you're a caregiver, you would need to have the Ilets exam. So as I stated before, so this is an application by invitation, and it's based on the labor market need, and also if they have a target for the year. The year has just started, and if you see an opportunity like this, and if you don't have the NCLEX now or the Ilets now, you're interested, you can do this. You can do go get that and then try and apply again. I would love to take the NCLEX and how. So if you're going to take the NCLEX, you can do it on your own. You need to have your resources. Make sure you use resources that are very good, that you can, depending on your study style, you have Kaplan, you have UWorld, all of that. You can go with NCLEX Navigator, who can help you to set up the entire process in terms of payment and licensing and everything. And I don't know if she's on here right now, but you can send me a message if you want some more information. I'll send you over to her. Teacher Sue says she's a certified LPN. Which country are you in? So if you're a certified LPN, you will qualify for licensed practical nursing, but I want to make sure which country you're in. Let me know which country you're in. Jamaica. Have you taken license? So you're a certified LPN. Are you an enrolled assistant nurse? Let me know, Teacher Sue. So this is one of the things that I wanted to clear up. See, for the licensed practical nurses, the licensed practical nurse in Canada would be equivalent to an enrolled assistant nurse in Jamaica. So if you are an enrolled assistant nurse, you have taken a license exam, you would qualify for this. But before you can apply to the program, I would advise you to make sure that you have taken the NCLEX-PN, because that's what they use in Canada. So if you do the process and you get through and you go to Canada, you won't be able to work. You have to make sure that you have taken the NCLEX-PN. NCLEX Navigator also does that service, so she helps you to take the exam, set up your licensing and everything. You can reach out to her too. If you want some more information, you can reach out to me in my DMs. So you would qualify for this, but you make sure you need to have your Ilets and you need to have taken the NCLEX-PN. All right, so Bomless says she's just a practical nurse. So if you're a practical nurse, you may qualify under a nurse aide, orderly, and patient associate. So they have that listed here. Is there any support staff roles available? So for support staff roles, give me an example. I said they had listed here. I don't know if they had physician assistants or orderlies. There were some categories. If you guys need support in the NCLEX, I can put you onto some persons that offer the services in terms of how for training and coaching, and you can send me a message with same. Any other questions? So if there is support staff, I saw something for orderlies, so it may qualify for same. Let me see if I can pull it up back. And you just make sure that you have some form of certifications and you have the Ilets. How to apply to pharmacy assistant physician from Trinidad. All right, so they had pharmacy assistant there and technician. You just need to make sure that you have your Ilets. I don't know what some certifications they would require in Canada, so you will make sure that you have your certifications from your home country, and you do need to have the Ilets. Is this for persons only in Canada? No, I think you just came in. This is not for persons in Canada. It's an international. This is a Saskatchewan Immigrant Nominee Programme. So this is a program that they created for international healthcare workers to bring them to Canada. So if you're outside of Canada, this would qualify. I don't know if you're in another province, if maybe you could apply to this province. I wouldn't be sure on that. Welcome to those that are just tuning in. Let me see if I can pull up the other qualifications that you guys listed. All right, so for the person who asked me about support services, they had listed here other assisting occupations in support of health services. So that may be a role. So Blessed and Highly Favored says she's in Jamaica. Thank you. Hopefully I answered the question. For geriatric nurses, I think you guys would qualify under, as I said before, you guys would qualify under that of nurse aide, orderlies, and patient associates. So you would qualify for that area. And you also need to have your Ilets. Very fabulous. And all of this I'm doing right here, guys, you can come over to YouTube and you can see the different areas that I have set up in terms of different occupations. Very Fabulous was asking if you can take your family with you. I am not sure about that, but more than likely because you're doing permanent residency. But that's a question you could send an email to them. They have it on their site, an email, and they also have an email address and a number that you can call them. All right. So this is a Saskatchewan Immigrant Nominee Program, and it's an program for international skilled workers. So you have two pools. You have the pool for the express pool, and you also have a pool for occupations that are in demand. And I've already listed out those occupations that are in demand. Any further questions? As I said before, it's an application that you initiate with the expression of interest on their profile. It's there on their page. Once you do that, you make sure you have your educations and your certifications and your Ilets passing score, and then you upload your documents in a PDF format. After that, you would then be given the approval, and then you'll be given a nominee. And from that nominee, you'll be then able to apply to the government of Canada for immigration. So this program, they said, has a target. I don't know what's the target for the year. They also have a labor market need, but healthcare is always in need. I don't know which place don't need healthcare workers right now. And this is an application by invitation. I think this is a good program. As I stated before, many a times you would have to apply directly to the province, have Ilets, have everything, and be looking for a job offer before you can apply. But this program is allowing you to apply, and also recruiters will reach out to you or employers and may give you a job offer, and then you can apply to see. Already talked about the licensed practical nurses for those that are joining us. A licensed practical nurse in Canada is not equivalent to the practical nurses in Jamaica. Who is Amanda Khan? Where do I get the info to apply? I have a diploma in practical nursing. Go to Saskatchewan Immigrant Nominee Programme. I'm trying to type it in here, guys, and I can't. I don't know how to do the typing here. All right, I'm just seeing Angelica say, just logging in. Do you have anything for healthcare assistance? It's a waste of time if you don't have a family into Saskatchewan. It is the expression and interest. I did it. Okay. Let me know further if you did it. What happened? Let me know. Healthcare assistant is listed there. They said nurse aide, orderlies, and patient associates. So she's saying it probably be a waste of time if you don't have a family there. That's why I'm saying you're going to need money. Remember, you're doing a permanent residency. You have to show that you have some amount of money you can supply for yourself and your family for our first couple of months. If you don't have family, you have friends that nearby can help you. Group economics, remember that. So it may not work for you, my dear, but it can probably work for other persons. I'm trying to type, guys, here in the chat. I remember I'm not used to this thing over here, you know. So it's Saskatchewan Immigrant Nominee Programme. If you come on YouTube, you can see it. Let me type it in the chat on YouTube. I'm not sure how to type it on TikTok. Any other questions? So everything that I listed here is on their site. You can find all the information that I listed here, the numbers in their email address, and also their numbers to call. Please make sure that you guys have the Ilets. I said, guys, it's a point-based system, and that increases your chance of selection. Any other questions? Your Ilets is your number one thing if you're interested to work in any country. Anywhere across the world, you make sure you have your Ilets. Some countries may not require it, but it's your English exam and you need that. How much is it to sit the exam? Very Fabulous stated. Which exam? Let me know which exam you're talking about. So Very Fabulous, let me know which exam you're talking about. A lot of exams are out there. Any questions from those here? I gave the answers to those here on YouTube from Terbu and Angelica. Let me know what your experience was with the program, Angelica. Let me know in the chat. Very fabulous response to me. Let me know what exam are you talking about? The NCLEX or the Ilets? Which one? If you're tuning in, couple of you say you're tuning in from Jamaica, you can get the Ilets done in Jamaica. I think it's over by UE that you can get it done. So that's the Ilets, yes, ILETS. I think the last time I heard it was around $30,000 to do it. Don't quote me on that. I'm not sure if Sati is here. I could ask her. Anybody that is here, I think the last time it was $30,000 and it's done over. You can sit the exam at UE. So that was around that 35. So Marsha said 35 there, about $35,000 to sit the IELTS. The IELTS lasts, once you do the exam, it lasts for 2 years. And I think after it's up, you have to renew same again. So if you're not within the country during that time and it's up, you'll have to renew it again. I think if you matriculate, you'll be fine. But if you're still outside the country that you're intended to go, you'll have to renew it once. It lasts for 2 years. So if you're interested to work, go anywhere, I suggest you guys to take that exam. Last year, they had the caregiver program, the caregiver worker program, and the IELTS was recommended too. So it's best if you have the IELTS, so when opportunities comes up, and if you have it and you're successful, you will have the opportunity to apply for any of these programs. So 30 to 35 thereabout is the cost to take it. Any further questions, guys? Remember, guys, especially the nurses, I'm not sure what will be the, make sure you have the NCLEX and your NCLEX-PN and the NCLEX-RN if you're interested in this program. So if you're out of school right now, you're waiting, my biggest thing that I advocate to you guys, try and take the NCLEX. While all of that information is in your head from university, try and take the NCLEX. It may be a cost if you take it on your own, but take the NCLEX. All right, so Angelica says yes. I think Angelica did this program. She said it's a point-based system. The best thing, especially for a person over 35, she said, is to do the French language, to stay in Jamaica, then apply for the French poll. Maybe Quebec, you may have a better chance. Angelica is maybe saying that they have an age limit, so probably if you're over 35. Just checking, just said good night, just joined PSW course. How does that work for Canada? I'm not sure about the PSW course. I know the PSW course is a personal support worker course, and I know that you have to be in Canada to take that. Most colleges and universities offer that program. You have to be in Canada to take that. I think it would be equivalent to what you call like your caregiver and what we have as the practical nurses do in Jamaica. That curriculum will be similar to your PSW, but you can't transfer with that to Canada. You have to do their program in Canada for a PSW. There are different colleges that offer it. I know one college is probably Humber College, Technical College. You can research some colleges and universities in Canada and see how the process works and what's the cost for it. All right, you're welcome. Any further questions, guys? I'm going to wrap up at 9 and we're at 8:51. Thank you guys for joining. Did anybody know about this program before? I may have another opportunity coming up. Remember to sign up for the newsletter. Let me see how much charge I have left here. 4%. I may soon die on TikTok. Can these courses be done online? All right, so for the PSW course, I know that you have to be physical. You have to be in Canada for that. If you're going to do the NCLEX and the any NCLEX and the nursing exam, that can be done. I think you have to find a peer review center for that, but you can do your studies and also online. But those who are RN, PNs, that has to be done at a peer review center. Peer review centers, you can find them in US. If you're in the UK, you can find some there. South Africa, Kenya. I think there's one in Guam in the Caribbean, similar to that, and one in Mexico. So otherwise from that, the IELTS too, you can do your studies on your own and then you go sign up to take the IELTS at the University of the West Indies. All right, my phone soon die, guys. My phone soon die, and I won't be able to speak to you guys. I'm going to end this. So can you tell me what program you were talking about? Just joining and realizing that you're wrapping up shortly. Yes, I was talking about the Saskatchewan Immigrant Nominee Programme, which is called SNIP. And this is a program for healthcare workers. If you want, you can see this on my YouTube live. I will end in this stream here, and that will be recorded on YouTube. And they have listed out a number of individuals who qualify for this once you're a healthcare worker. And this is done on the government website, Saskatchewan Immigrant Programme. You can just type that in and you will see. And they list out the different pathways. What you do is create a profile, submit your resume, make sure you meet the necessary qualifications, make sure you have the Ilets, and then you submit your documents in a PDF format. And once you're selected, I think they will allow you to be seen by employers who will give you a job offer. And then they will send you up as a nominee to the government to apply for your permanent residence. So this program will be a little easier instead of you on your own applying to other provinces, trying to seek a job on your own. So they will nominate you for say. You can go on the website and you see everything that is listed there. If you are selected, they will notify you and then you are approved for a nomination. We talked about the Ilets too, where you can find the Ilets for which country. So this is for Canada. So it's for international healthcare workers. So it means any international healthcare worker. It is broad. They didn't specify. So if you're an international healthcare worker in anywhere across the world, you could apply for this program towards Canada. It's based on the labor market need, and they also may specify. They did state a target, but they did not put a number there. And it's by an invitation. Increasing your chances. It's a point-based system, so you make sure you have the Ilets. Passing score is a 7. Make sure that you have your necessary certification. For the nurses I talked about, make sure you have your NCLEX-PN or your NCLEX-RN. Other caregivers and all of that, make sure you have your certifications for same. And if you're an orderly, this is the healthcare worker stream. And Ilets pass number, I think that I saw it on the site, it was a 7, so you have to have that pass number. You can take, if you're in Jamaica, you can get the Ilets on a UE. It's around $35,000, I think. I don't know how you can go about. I don't know if you go through CXC or University of the West Indies to do same. I can do a video and tell you guys how to do it. Legal or it's 6.5 currently. I was aiming too high. So it's 6.5. I actually saw for the nurses 7. So if you're an RN, I saw 7 by the registered nurses. The Saskatchewan Board of Nursing said 7. Legal law said CXC. What you said is your number, Lee. You have a 6.5. Oh, that was for the nurses. I don't know what would be the other number required for the other qualifications listed. So legal lawyer said you register through the CXC office, okay, and then you can take the exam over, I think, by UA. $35,000. So if you're interested in the program, guys, make sure you have your Ilets. Ilets last for 2 years. And if you're still outside of the country and not matriculated to the country as yet, you'd have to renew same, or I think probably take it over. So 2 years. So you're a community health aide. They do have nurses aide listed, orderlies, and patient associate guides. So remember, it's a permanent residency you want to apply for. So you still have to show some amount of money that you will have to maintain yourself. Okay. Don't know how much, and if you're going to do that by yourself, you have to and if you have a family of 5, you times yourself and the amount you would take for yourself by 5. All right. If you're interested to work overseas, you do need money. If you're already complaining that you don't have money, I don't think you're ready to move overseas. So delusional criticism. I love your name. Look at the question you're asking me. Empower is a name. What do you empower? Yes, empower is a name. I empower anybody who follows me. Once you are a health provider, anyone, Empowered RN. Started off with regards to empowering nurses, how to find opportunities and to take up space in wherever they go. So that's why I call the page Empowered RN. I'm sure you have been empowered from this information and the information and the opportunities that are out there. I love your name though, delusional criticism. Any other questions? This can be done on your own, guys. If you do need the assistance of an immigration representative, a consultant, or a recruiter, it's listed on their site who you can go to. I am not an immigration consultant. I wish I was a lawyer. That was my first love. I ended up being a nurse. So let's see how things go for us. All right. And you have recruiters that you probably can reach out to them. So delusional criticism, say I got enough from that. Thanks. Great. All right, guys, let me see what's the time. Chantel is just joining us, Chantel, and we have 2 minutes to go. 2 minutes. Anything for practical nurses? All right, Chantel, practical nurses, where are you from? If you're looking for practical nurses, it will be that of you will come on the nurse aid. Practical nurse in Canada is not similar to the practical nurse in Jamaica. If you're a practical nurse, for the licensed practical nurse, if you're an enrolled assistant in Jamaica, that would be your category, right? The enrolled assistant nursing qualifications is similar to that of the licensed practical nurses in Canada and the United States. They can take the board exam called the NCLEX-PN. However, for the practical nurses, if you're a practical nurse in Jamaica, you don't have a license, you only classify as an orderly or a caregiver. Once you have a license, those are the ones who would qualify, but they do have caregivers there. But one thing that you'll need is that of make sure you have documentation of your certifications, and you do need the Ilets. So that is also listed there. If you're just joining, head over to YouTube. This will be live, and this will be recorded. It's recording now, and it's also will be on YouTube where you can rewatch same. All right, guys, we have 1 minute to go. I think I have another opportunity that I see. Hopefully it's not past. Remember to sign up for the newsletter where I'll be posting job opportunities in the Caribbean and globally. Where to get a practical nurse license, Bombless. All right, for the practical nurse license, you would have to go back to school, become an enrolled assistant nurse. Enroll in that program. I think it lasts for 18 months or 1 to 2 years. And you will have a board exam to take, and you get a license number. Those professions have a weight, and they are bounded by laws and regulations, right? So that's how you'll get a practical nurse license, become an enrolled assistant nurse. In Jamaica, I don't know about the rest of the Caribbean, but they wear the same uniform as the nurses. The only way you can distinguish them if you see them with their badge, they have a green badge. And only way you can distinguish them if you look on the rota that you see on the hospital ward or unit that says EAN beside their name. This course in Jamaica is offered at the, I think, community colleges, Portmore Community College. So if you want to do that, you can go that route or become an RN. So that's how you can get a license for same. All right, it's 9 p.m., guys. Thank you so much for being here. Thank you to everyone that tuned in. If you're just joining and like to watch this again, you can come over to YouTube at Empowered RN, and it will be there live for you guys right now. I'll see you guys in another video. Thank you guys so much for all the questions. Let me see. Angelica just posted something. If you're a PCA studying for 18 months, that's an enrolled nurse assistant studying advanced medical terminology and pharmacology. That's what I studied in Jamaica. So that's the enrolled. That's the same thing I probably just said a while ago, the enrolled nurse assistants, right? So you're studying the keyword that I like what you listed, advanced nursing, medical terminologies, right? And those nurses can transition to becoming RNs too. Heart Trust Vocational Institute offers it too. Okay. All right. So, guys, I'll see you guys in another video. Thank you guys for joining. And that is it for tonight. All right. Thank you. Bye. You guys can come off, guys. I don't want to end it with you guys still being here, so you can leave and then I end it. All right, thank you guys for those that tune in on YouTube. Nurse Life is saying, what is a PCA? That's a personal patient care assistant, right? So that would be similar to your healthcare assistant or your caregiver. I think Heart Trust NTA in various hospital would term a patient care assistant. Back home, these are like the nurses that will wear pink in the hospital settings, right? That's what we were talking about. Patient care assistant. So you guys would not be termed a licensed practical nurse. If you hear the term license, that means you have a license number, a PIN number that you are accountable to. So anything is made against you, your license number. That's what stands, and that can be taken away from you. All right. All right. I'll see you guys in another video. All right. Or another next content that we make. All right. Thank you guys so much for being here.